Festivalové vteřiny přinášejí další rozhovory. V prvním rozhovoru se dozvíte, proč se stát členem sekce mladých gastroenterologů, a druhý rozhovor si pro vás tentokrát připravila paní doktorka Ďuricová, která vyzpovídala vzácného hosta ze zahraničí, pana doktora Löwenberga z Amsterdamu. Proč se stát členem sekce mladých gastroenterologů?
Tak určitě je lepší být členem mladých gastroenterologů než starých gastroenterologů, ale teď vážně a čistě pragmaticky to členství vůbec nic nestojí, vlastně ani od členů nic nevyžadujeme nebo nepožadujeme a naopak, když mají zájem, tak můžou využít vlastně podporu ze strany výboru České gastroenterologické společnosti, ať už v podobě třeba úhrady registračního poplatku trainee členství v SG, anebo finanční podporu, ať už na tuzemské nebo zahraniční kongresy. Takže myslím, že to je výhodné a že je fajn být členem.
Co si nenecháte ujít v rámci odborného programu konference?
Tak já si určitě nenechám ujít a byla bych ráda, kdyby i ostatní si nenechali ujít sekci právě mladých gastroenterologů, která proběhne zítra, tedy v pátek po obědě, a která se bude týkat problematiky Choosing Wisely, která vlastně i na poli celé České gastroenterologické společnosti je v posledních letech hojně skloňovaná. Takže myslím, že by to mohlo být přínosné nejenom pro mladé gastroenterology a budeme rádi, když všichni na naší sekci zavítají.
Je něco, co byste chtěla vzkázat členům České gastroenterologické společnosti nebo účastníkům této konference?
Já bych chtěla všechny pozdravit a určitě jim popřát, aby si kongres užili, ať už po odborné stránce, tak vlastně i v rámci nějakých sociálních interakcí, protože myslím, že tomu není tak dlouho a všichni si moc dobře pamatujeme nedávné roky, kdy jsme se mohli potkávat jenom virtuálně, a myslím, že to setkání tváří v tvář a možnost spolu komunikovat nic nenahradí, takže můžeme být vděční, že tady všichni spolu můžeme být a společně si to užít.
Hello Mark, I'm very grateful that you accepted our invitation. You had a very excellent, great talk in the morning. I know that you are very active in research and publications. So what is your main topic in research regarding IBD?
Thank you, Dana. Well, it's a pleasure to be here. And I'm impressed actually by this whole congress and venue and all the possibilities that you have. So we run a quite active clinical program at our medical center in Amsterdam. We have a large clinical trial unit, and I'm supervising that. So that's the pharma studies and also the investigator-initiated studies that we do in parallel. And my main research topic is optimizing treatment strategies in inflammatory bowel disease, and I'm particularly interested in imaging and also in fibrosis.
So do you use ultrasound in a clinical practice?
I myself do not the ultrasounds, but we have one gastroenterologist, one nurse specialist, and we have 2 or even 3 Ph.D. candidates who perform the ultrasounds, and that's I think 4 days per week, and then 2 programs per day. So I think it's 8 programs per week that we where we perform the ultrasounds at the outpatient clinic.
Because I'm a big fan of ultrasound. I'm doing myself ultrasound, and I think it's very useful, non-invasive investigation.
Yeah, I totally agree. I think this is one of the main interesting research topics, and it really improves the care of our patients that we can deliver. So I'm a big fan as well.
Thanks. I think in clinical practice I have big problems that we have quite a lot of patients who are difficult to treat, mainly in Crohn's disease. So where do you see the biggest challenge in treatment of patients? I mean, lack of enough sufficient drugs, or maybe we are using it in the wrong way, too late, or maybe we miss some reliable predictors of treatment response.
Yeah. So I agree. Also at our center we have a tertiary referral center. We have a lot of patients, especially Crohn's disease, with a suboptimal poor response to the therapeutic agents. I think one of the most important aspects is to identify which patient will respond to which therapeutic agent. At the moment, it's more a phenotypic picture that will guide you in deciding which therapeutic agent to choose. Sometimes it's black and white and easy, but often it's a gray area. So a lot of, I think research is going on trying to find markers, molecular markers, epigenetic phenomena that in the nearby future hopefully can help us in deciding which drug to choose.
And do you think that maybe in the near future we'll have some really reliable molecular marker? Because I'm a little bit skeptic about it.
Yeah, I understand.
There has been research for a long time, but no results we can use in a clinical practice.
I totally agree with you. So I'm also skeptical. However, there's one exception. I think with regard to epigenetic phenomena, the methylation profiles suggest that at least at this level there might be markers that can be used for this particular purpose. There's a large initiative that's been initiated at our center by Geert Daans, using a DNA methylation profile, trying to predict who is going to respond to vedolizumab and ustekinumab using an AI model. So this might be very interesting. And we've also some data that can be useful to predict which patient will respond to an anti-TNF agent. But so far, we don't have any tools that can be used for daily practice. But hopefully this will change in the coming years. And with regard to your first question, Dana, I think combining agents will be interesting. Maybe start with a potent drug, a JAK inhibitor, and then move on to a safe maintenance agent. So this will also be an important approach to investigate in improving the outcomes of our patients, especially the refractory patients.
Thank you very much. And you are coming from Amsterdam, which is a center of excellence of IBD, not just in Europe, but I would say worldwide. And you are organizing different events and symposiums. So is there any in the near future you would like to invite us? Professor Lukáš already mentioned something in December.
Yes, that's quite soon. Within a few weeks from now, we will organize a symposium on therapeutic drug monitoring across different disease entities. So it's not only gastroenterologists who will be invited to speak, but also rheumatologists, dermatologists, healthcare insurance company. So this will be a TDM symposium. We have some workshops, but that's basically it, except, and of course the big congresses such as ECHO, where we always go to, and UEG and DDW.
So thank you very much, Mark, once more that you accepted invitation, and I hope you will have some time to enjoy also Karlsbad and the spa and the hot springs.
Thank you.
Yeah.
Thank you too.